This is Eyewitness News Health Beat.
And topping the Health Beat tonight at 5 o'clock, a brand new push to recognize the signs of diabetes as well as seek treatment before the complications really begin to add up. Our Health Beat anchor Anne-Marie Turner joins us now. She met one man who hopes his story inspires others to stop being in denial.
Well, it took a lot of courage for him to come forward and share his. We do so much. You know, doctors and patients say, unfortunately, it does happen all the time. Patients that have diabetes don't take the diagnosis seriously, don't monitor their sugars, and the resulting complications often are irreversible.
Okay, 1, 2, 3. I don't know how many times that I've went to use my left leg, and I get that sudden jolt that it's not there anymore, and that just blows my mind.
David Richardson is just 49 years old. His left leg was amputated in August.
Instead of looking at feet, I'm now looking at a stump and a foot.
His rehab at American Senior Communities Countryside in Avon is nonstop.
Kids, don't try this at home without supervision.
He's also working on arm strength to help him manage his wheelchair.
Never in a million years would I've ever thought this would have happened.
David remembers when doctors told him he had diabetes.
I denied it. So yeah, I just ate whatever I wanted to and whatever I felt like.
But no more. Now David's blood sugars are tested, his insulin adjusted before specially prepared meals.
You know, you like to see a plate that is a quarter of starch, a quarter of meat, and the other half would be non-starchy vegetables.
When you eat at the buffets, you always go back several trips, or at least I did anyway. So I'm still learning size control. I mean, to me, this seems incredibly small, but I know that's a normal size proportion.
Richardson says his sores will no longer go unnoticed.
They've taught me to look at this and not be afraid to look at it. And so I keep an eye on making sure that it doesn't get infected.
And he hopes his situation will encourage others to manage their diabetes better than he did.
Yeah, in the back there, sir.
Okie dokie.
And he says, you know, the bottom line is that if you look at him, he says, look at me and think, do you want to be like me, or do you want to make a difference and manage the symptoms that you have? Getting the diagnosis is the key. Doctors say a majority of Americans with diabetes don't even know that they have it, and getting the diagnosis is the first step to controlling it. The symptoms include excessive thirst, frequent urination, blurry vision, slow wound healing, tingling in hands and feet, and fatigue. So connect the dots. That's part of the message here. And then also, if you have that diagnosis, take it seriously. Watch your blood sugars.
And again, we thank David for sharing your story. Definitely will. Hopefully, it will help somebody else.
Absolutely.
All right, Anne-Marie, thanks for the Health Beat tonight. Here now is a look at what's coming up next at 5:30. John.
Coming up, Dr.